and joining our panelists. Okay. I just want to thank everybody for coming out. Um, we're going to begin in about 2 more minutes. 2 more minutes, we'll start.
It's Friday. It's Friday. It's Friday. Black folks about to talk.
And the holiday Monday.
Oh, and you know
So
what?
long weekend.
Hey, what's popping off in DC this weekend? Y'all about to be partying?
I know y'all better check out 8th Street, period.
The epidemic.
Oh yeah, I mean that I get it. Socially distanced, are y'all about to party?
So
we up and popping via Zoom.
Ooh.
And staying warm by the fireplaces.
I mean, you know, I'm in California. You know, we can't do nothing. But I mean, DC, that's a big deal, you know.
We can't do nothing either here. Thanks to y'all Californians.
Oh, right, because we got that new strand, huh? It just keeps on getting better and better, huh?
All right, so that was the final 2 minutes. We can go ahead and get started. Again, I want to just thank everybody for coming out on their Friday. I know we got to enjoy our weekend. I know I'm ready to get into the weekend myself. Well, first, I'm going to start off by just introducing myself. My name is Trayvon McClainell. I'm the program coordinator with Damien Ministries. I was going to go ahead and introduce the panelists, but I feel as though I think they can, you know, give a better description of their bio itself. So I want to just go ahead and start off by with Allison, and just give everybody like a brief bio of yourself, so we know who you are.
Good afternoon. I'm Allison McKeithen. I work for NMAC, but I'm just here as a regular Black woman living life in PG County, Maryland. So I'm glad to be here. I'm excited to be on the panel with all these exciting people. Thank you for having me.
And we can have Jeffrey.
Sorry, I was muted. Hello, Jeffrey Richardson. I am the principal and founder of Inspired Music Coaching and Management. Also work with Damien Ministries around community engagement programs. And I'm just a DC Ward 7 resident who believes that the spirit can overcome all. So happy to be here today.
Thank you, Jeffrey. Thank you. Next, we have Mrs. Anderson Harvey.
Thank you. So good evening or good afternoon, morning to some. I don't know what time it is. 2 different time zones, but I'm Carmarian D. Anderson Harvey. My pronouns are she, her, and hers. I serve as a senior staffer with the Human Rights Campaign. I serve as the state director for Alabama. In addition to that, I also serve as the national co-minister for the National Office of Trans Saints of Affirming Ministries under Yvette Flunder for the Fellowship of Affirming Ministries. And I'm looking forward to having this intentional call as it relates to what is our part as a community to end HIV. So thank you.
Thank you so much. Thank you. We're glad to have you. And last but not least, we got our California rep, Mr. Corey Moreland.
Hi, how y'all doing? My name is Socorro Corey Moreland, Corey for short, obviously. I'm in Oakland, California. Do a lot of activism and advocacy around trans masculine community, founder and CEO of Brotherhood 510.org. I also am the deputy director of services over here at AIDS Project of the East Bay, or APEB. I'm actually sitting here with Yvette Flunder right now. I've seen them this morning and every day. I'll tell her that you're here, and just really happy to be here. Also a member of Alpha Omega Kappa Fraternity Incorporated.
All right, thank you for that, Corey. We want to just go ahead and start off the panel discussion with a nice little icebreaker, which would
So
just be
before before we get started here, we gotta let everybody know why they're here, Trayvon.
okay.
So what they're here for? So what everyone's here for? We're here for ending the epidemic, the role of the Black community. We're here to have a conversation. That's why everybody's here. All right. And so my name is Tyree Williams, and we're part of Damien Ministries. And before I'm gonna let Trayvon get y'all with this kickoff breakoff question, but I had to let y'all know what we were here for. All right.
All right, thank you so much for that, Ty. So the icebreaker question would just be, what is your favorite place to vacation? I know with COVID and the travel bans and restrictions and stuff like that, let's say, where is one place that you wanted to travel in 2020 but didn't actually get to? And we can start it off with, let's go with Corey, since you went last time.
Well, I don't know. I was looking forward to going to Puerto Rico with NMAC, but that didn't happen. No shade. Excuse me. And so I'm actually wanted to go to New York because I like food a lot. And so because I'm Puerto Rican and because I have Caribbean ties in my family, I'm one of them people, I'll go on a food tour. And that's actually what I'm trying to do as soon as things open up. So yeah, that's the ideal vacation.
That was nice. I was actually looking forward to going to that Puerto Rico trip as well. I'm sadly disappointed.
We need a redo.
But I'm looking forward to the future as far as everything's good with the vaccinations and stuff like that. So I think, normality is actually on the horizon. So I'm looking forward to that. Jeffrey, where you want to go? We'll be vacationing to.
Hey, Puerto Rico sound good, but anywhere, sun, beach, I'm there. I was supposed to be back in Cape Town, South Africa, but Kovanka, as I call her, Kovanka said no. She said no, not this year. No South Africa for you. But that as soon as I can. Cape Town, here I come.
I'm like you, I love South Africa.
Yes.
Okay, Allison, where would you like to vacation? I'm sorry, where would you have liked the vacation to in 2020?
I'm like Jeffrey, anywhere with sand and sun where I can just lay out and have drinks brought to me. That's pretty much game on. And yes, Puerto Rico, I feel you with that. We'll get back to Puerto Rico, trust. MX going back to Puerto Rico. No worries. We'll get there. Let's let this calm down some.
All right, and last but not least, Ms. Anderson Harvey.
It's interesting, everyone is saying Puerto Rico, so I feel like I'm the oddball, but in 2020, I actually got married and eloped during COVID, and my plans were to elope either in Maine or Vermont. Those are not sunny places, but those are beautiful places I've never been since in my travel in the United States, and so I'm still looking forward to going there just to witness, our other counterparts, but the beautiful scenery.
Awesome. All right, so now that we got that, I want to go ahead and begin with our first question. And we're going to go ahead and start with Allison. So, Allison, how does culture, religion, and traditions impact caring for Black communities?
I think that those come in very early on in life, right? Those are the things that kind of set the pace for how you're raised, the belief systems that you have, and how you carry yourself into adulthood. And kind of they set the tone. We have in the Black culture a culture of we don't like superstitions. Don't step on a crack. Those things carry through. We do have rich culture though, as Black people. We have our soul music, our jazz music. The origins of music is a beautiful thing. But culture, it impacts us in so many ways. And it really kind of filters what our belief systems are, and the truths and the lies. As far as how we move through the earth. So it's a huge influence starting early on.
And how about you, Corey? How does culture and religion and traditions impact caring for Black communities?
Culture and religion, right, are things. So let's start with Black community, right? There are different Blacks within communities, right? And that's really important to remember that even as Black people, we are a diverse people. And we are the originators of many things, actually majority of things that are here right now. Even when we talk about certain technologies, when we talk about style, when we talk about everything, if you look at anything, it's influenced by Black people. When we talk about culture, though, culture is a little bit interesting because it really depends on the syndemics that happens to whatever Black group you were a part of. And why I say the syndemics is because we really don't know what happened before colonization. We have an idea, but there's nothing set in stone, right? And so all these things that we have adopted came from other people, and we just made it look good. And so for me, for instance, culture to me starts from the day you're born, because in reality, as a whole, you develop certain ideals and certain thought processes towards other things. So from day one.
Thank you for that. Jeffrey, you want to follow up?
Ditto, ditto, ditto. I think, particularly for Black folks, with culture and religion, when you are the culture of the world, when your foundations of spirituality and religion are the foundations of the world, it is, culture and it is intertwined. I think the difficulty, particularly for American descendants of slaves and Black folks in the United States, is, as the brother was saying, what is actually our culture, what is truly ours, and what existed prior to colonization and slavery in this particular country. So I think we continue to struggle with that identity battle because of all that. Because when it's all yours, but you don't know what's yours, you either got to figure it out or wait for somebody to tell you.
Thank you for that. And for you, Marianne, how does culture, religion, and traditions impact caring for Black communities for you?
And I agree with the other panelists. Jeffrey started what I was going to share was there is a foundation, there's a roadmap to our belief system. And I think I'll tie in and speak to the latter part of the impact of care within Black communities. I am from the South. I'm a Southern belle, born and breed, grease and butter at the same time. And I think it's important that because of culture, it's a twofold. One, for culture that we represent is very tightly knit, and therefore it's hard to penetrate. And then the other part is that for those that are doing the work as it relates to HIV and the funding source where it comes from, don't know how to get into the culture. It doesn't know how to represent the culture. It doesn't know how to respect, per se, our culture. So what happens is that we're not on the same page. And when we're not on the same page because of our culture, if that's from home culture, spiritual and religion and faith culture, traditional cultures, prime example, if I'm cooking some good pig feet or some good pork neck bones, if you don't put a splash of vinegar in there, I don't want any because I need something to cut it. That's a culture for the South. And if I'm looking at being recruited by HIV entities and they don't speak to the nature of how I do my recipes, it's hard for me to relate and hard for me to believe. And then that increased mistrust in regards to Black health.
Can I also add in real quick? I also think that also there's also culturally, if we're talking about culture, intersectionality generationally is also a situation, right? So say, for instance, you can tell me what happened in 1960 and 1970, and I'm gonna hear you out. And I'm gonna empathize, and sometimes I might sympathize, but at the same time, that's also not the recipe that we should go for, not necessarily in 2021, right? And so let's also add that in, because there's also a sense of, when we talk about culture, there's also a sense of traditionalism, and there's also a sense of like what was happening back in the day, right? And so applying that, applying both, having intersectionality when it comes to like implementing what culture means, right? Because again, you were talking about like grease and butter. In California, we don't really use grease and butter. We use other things, right? And so in reality, we have to be open to that as well, and also mold something so that we can all come together. But I hear you, and I agree with Carmarian 100%.
And thank you for that, Corey. I actually want to circle back around to Ms. Camarion and just ask her what's needed to address the medical mistrust and increase of utilization of the healthcare systems among communities. I'm sorry about that.
So when we talk about mistrust, I think that one of the conversations that we don't often talk about is where that mistrust comes from. It almost goes into the conversation of our culture and how we are reared, because those become the standard of what our beliefs are. And if anything interrupts that, let's think about religion. That's my background. So let's think about how we even promote sin. That, you know, if I'm not going the straight way, then if I'm going the narrow way, then I'm being judged. And so I'm not included. So we have to think about the messaging. We have to think about how we're doing this work in health disparity to see if we're reducing the level of stigma that counteracts our cultural beliefs. So the mistrust comes from a place of stigma, and then it comes from a place of intentionality. Corey hit it earlier, is that as a woman of trans experience as myself, I need to be able to see my intersectionalities in the plans of ending the HIV epidemic. I need to be able to walk into your brick and mortar ASOs and CBOs and maybe recognize that this place is inclusive for a person like myself. Being Black, intersectionality, being a woman of trans experience, but even those things you can't see, me being a Q spiritual person. I don't want to go into an agency and all I see is two people hugged up that I can identify. I don't want to hear music that's taking me through sorrows because every day I'm trying to find out where my next meal or housing is going to be at. I want someone to say, hello, how can I help you? And perhaps I can identify with them. Those build to me mistrust when the product that we are trying to market does not resemble back to the culture, the intersectionality, and it all is because of being intentional. The final piece that I'll say is that if we can learn the model of extended grace, I'm not preaching, I'm talking about if we can see ourselves when we're helping any individual, any community, and see ourselves in them, then therefore we will cross all of our T's and dot our I's to ensure that we're all on the front line to make sure that stigma is reduced, that trust is increased, and we can reduce the HIV epidemic within our Black community.
Okay. Thank you for that comment. Jeffrey?
You know, I think part of it is that in America, we really have a disease culture. And sort of talking about culture, there is a disease culture. And I think particularly when you start talking about Black folks, poor folk, particularly American descendants of slaves, there's not only a disease culture, but there is an ascribed responsibility, right? So Black people in America are diseased because Black people are diseased. It's our fault, right? Our responsibility. And sadly, within community, as it was just being discussed, sort of stigma within faith and religion, that's echoed, right? It is your behavior, it is your actions, it is your proximity that has created the disease and the health issues. And therefore, that's why culturally, well, we don't need to put money into health access for you all. We don't need to put money into medical services, addiction recovery, mental health for you all, because you know what? It's your fault. It's you the problem. And so we have to reject that disease culture and replace that with something else, right? And I think that is that recognition of what existed before, that recognition of spirit, right? That recognition that there's more to us than the disease and symptoms that have happened as a result of colonization and slavery and all of that. But I think it gets back to, we keep accepting this reality of a disease culture that we're just disease and I gotta have high blood pressure, diabetes, and it's my fault and da 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 da. Yes, there's things that I need to do as a person that has that history to, you know, make a different existence for myself, but it's not all my fault. And we have to stop accepting that paradigm around that disease culture.
Honestly, you want to follow up?
Sure. You know, I think that it is very important, you know, to kind of experiment and really express where disease culture comes from. And it does have a lot to do with the fact that we're not, I will say a lot of us, because I do believe that a lot of Black people are indigenous to the Americas before people got here. But, you know, for the other, you know, group of us that are not indigenous to this land, this is not our land, this is not our culture, this is not how we live. You know, you go to other continents and see Black people living a lot healthier lives. It's kind of like, you know, how do we take what they do in their cultures and bring it to the United States and affect our health outcomes here? Also, you know, the mistrust as far as the medical system, I mean, it goes back far as I learned about a gentleman today named Mr. Hardiman, who was experimented on. He was radiation experimentation that he hid for years. And they did that to hundreds of Black people. They did this with Henrietta Lacks. You know, they used her genes and basically abused her and experimented on her and had her genes used in, you know, to make great medical revelations. But, you know, what do they do with our Black bodies? The Tuskegee experiment, the well-known one, like just seeing how they used us and abused us to make themselves healthier. And I say themselves because we know the establishment, we know the man. Is you don't want that to be you, you know, and I think it resonates not just through, you know, what we do with HIV testing. You kind of like, we don't want to be the guinea pigs, you know, the only guinea pigs. We don't want to be the silent experiments. We also don't want to be that when we talk about getting rid of COVID. We don't want to be the first ones in line getting this experimental drug to see if it's going to work. Like, yes, we do. We absolutely do need to be a part of the testing and the research, but let's not make it exclusively us and don't abuse us in that system. And so I believe a lot of correcting that is having representation in our medical systems, having Black people, having people of various experiences in our medical systems, making sure that they're our care providers. So like Kamaran said, so we can see yourself. You see that your auntie, your uncle, whomever is in your family represented in your patients. You see your grandma when she comes in there, she needs her heart medication. You have empathy for her. You want your grandma to get well. So you treat your patient in the same manner that you would want your grandmother treated. I think that's important. We need more Black doctors and researchers.
Infrastructure, if I may, infrastructure. We can't keep just in these crisis moments. This isn't the first health crisis that has been critical for, you know, Black people, brown people, indigenous people in this country, right, in particular. And so at some point we have to start recognizing the is the is, and the systems and institutions that have existed aren't going to change it. So how are we going to build the infrastructure? How are we going to build health access for ourselves and make sure that we get back to having those medical professionals and folks within, you know, our communities that come from our various perspectives at the table? We have to build infrastructure.
So let me chime in, and I think we can be real. I think call outs are appropriate. Please. And let me be the first to do that, okay? Because when we speak about, because this comment is resonating in the chat about why the disease of culture exists, and I agree with all of the panelists, but I want to take it a step further. First off, we're living in a created system. We buy into that created system as Black folks. Okay, this is respectful, okay? Not only do we buy into it, then therefore we don't show up at times to correct that created system that we have the power to counteract. Prime example, we as Black folks, I know growing up, the emergency room was my primary care physician. All I did was create debt, got pacified with some ibuprofen that I could have bought at the dollar store, and now I have a debt. The system was created for us, and if we're not careful, we allow the federal funding. Let's talk about it. We allow that to project where we should be because we are used to the system and not used to advocating what we know that we need and what we have. So that's the first reason why the culture still exists in the Black. Yes, there is some medical mistrust, yes, but we have the power to advocate for our own health. Therefore, when you don't see yourself recognized in advertisement, then that's the system that's been created. Academia-wise, we're not often written in history books from a public health entity, besides that we have high rates of diabetes, high rates of X, Y, and Z, and now we're written to having high rates of HIV because the system put us there. And I want the audience to hear, you are advocates. You are advocates for your own health, for your own community, for your own environment. And when we make that dent, then we can see that the culture will have a shift. I didn't say change, but it'll have a shift. And we are in a shifting moment, especially COVID is teaching us that. No one has been discriminated from COVID. What are we learning from that? Because we all have the ability to shift. And when the shifts start, because, you know, shifts happen, you know, not SHIT, but shifts happen. And they do when we show up and do our part to advocate for our communities. And therefore, the existence then won't be there. And we can be written in history how we're no longer the lore of of race, but actually we were the blueprint to change and be included for other things. COVID, if they reached out to us from what Allison said about all of the mistrust, we would have been had the antidote that we needed when a pandemic came in. But this is how they keep us in our slavery mind, and we must do better as Black people.
Can I also say that Primary, and I agree with you. I think this is great that we're having this realistic conversation, because again, a lot of times as Black people, we don't have the chance to have realistic conversations. It's usually kind of like pushed around like, hush, hush, don't let the man hear you. Hush, hush, your job is in danger. Hush, hush, if you say this, then you'll be blackballed. We also have to talk about the fact that all Black community are advocates and activists, right? And this goes along with HIV or COVID or anything else, right? We do have the habit of raising up gatekeeping and what that looks like, or gatekeepers and what that looks like. A great example is that I joined Clubhouse. I love that app. Many people hate the app. I love it, as Uhuru Hotep as it is. It really brings Black people, different Black people, into a space, and it creates a platform where we can have realistic conversations, but we can also learn how to facilitate conversations amongst each other. And it's not built by gatekeeping, because random Black folks can create a room and talk about these things. I think also we need to be realistic around who is going and getting the vaccine for COVID, or who is getting HIV care, or who is taking advantage of HIV prevention. And we need to decolonize our minds around trying to fit a European or colonized kind of like expectation for what that looks like. So that means, for instance, if you try PrEP and it works for you, don't change your language about how it made you feel as a Black person. From the time you walk in the room, from the time you get the prescription, from the situations where you talk to a provider or you did this, the same thing with HIV care, right? We as a people tend to let these places, who are majority white or non-Black owned and operated, dictate to us what is presentable and what is not, how you're supposed to act and how you're not supposed to act, how you're supposed to feel and how you're not supposed to feel, and so on. We have to get out of that and stop giving people passes. And I think that's also a situation, right? We have to decolonize our minds around the fact that people think we're some way, but that's because they don't know who the hell we really are, right? And just really showing people that if you are being who you are, you're being unapologetically who you are, because it's going to show. It's going to come out of you more than any other thing. Have you noticed how we code switch, but with each other, we can kind of be realistic as possible. And like, it's so chill, like we get it. I don't feel threatened. I don't feel anything, but other people do, right? It's the same thing with care. It's the same thing with prevention. It's the same thing with COVID. We have to decolonize our minds about what other people think we are, and we have to be our true authentic selves. And that means, you know, if you get the vaccine, go out there and tell people I got the vaccine. Like I said, Clubhouse, you know, Facebook, social media, Black people are now, we're technologically advanced. People see that. And so when you see things such as like the Truvada thing with the lawyers, where, you know, they go, call the lawyer, because if you took Truvada and your leg is falling off, you know, this is what it is. And people are calling in. But it's because, again, we are large consumers. We are some of the biggest consumers out there. We fund everything. Black people are about quality, not quantity. You know, if we're going to get something, it's going to be real. If I want a Louis Vuitton bag, I'm not going to go get a bootleg. I'm just going to go and pay it and go get whatever I'm going to get, you know, and it's going to be real, and I'm going to do it by any means necessary, right? And so, again, we have to think about that as far as for healthcare. We have to think about that as far as community mobilization. It's about quality. It's not about quantity.
Thank you. If you are just joining us, it's as you can see, it's getting heated, it's getting started. We're talking about ending the epidemic with the Black community. We're having a great conversation. My name is T.Y. Williams, so we're going to continue this conversation. Now, since we done got deep into the conversation, we're really going to get deep in there. So what do y'all think is needed, to my panelists? What do you think is needed for the Black community to wake up and educate themselves on HIV, period? I know some of y'all touch bases on it a little bit, but we really want to have, know your, like, what do you think is needed, and from what your experience is in life and what you have been to walk through, and what you feel like some could be educated, some could be just through experience, but what do you think is needed? And I'm letting anyone go ahead and jump in.
I think one of the biggest things, we use the word stigma. Behind that word is a lot of assumption. A lot of assumption about who these people are, right? Who we are as a community, who we are, the people impacted by and affected by HIV and AIDS. And so we got to get beyond these assumptions. We got to get beyond the assumptions. Brother was just talking about that these, at some point, these institutions are going to, the safeguard is going to go up. It can't get no worse, can't get going worse. I'm tired of people saying that. Well, clearly it can. We have to stop assuming that, and we have to just stop letting folks assume the worst and get to a place where we're comfortable telling our whole story, our whole truths. And we say that over and over again. And I think people just they leave that at sex, who you are attracted to, all those kinds of things. No, my truth is my whole story around how I made the decisions that I've made, how I found myself in the situations and circumstances that I found myself in, that I've made the decisions that I've made. I think particularly in the Black community, and particularly in the religious space, we just keep discarding people. We just discard people left and right, from family, from community, from village, based upon an assumption. And then we find ourselves in this place where we are today, where we have this growing, ongoing epidemic. Why? Because we keep letting folks just be discarded and they can't get help. We ain't willing to help them because of all these assumptions flowing in the space about who we are, why, and what, and we all are stuck. Because at the end of the day, as a whole community, as Black folk, poor folk, marginalized folks, we don't have all we need because you've left out a key unique tool you discarded because they were LGBT, because they had HIV, because they were addicts, whatever it was. And now you don't have what you need in your toolbox because you've discarded it. We got to stop with the assumptions and the discarding of people from community and family.
I think that's also, though, I hear you, Jeffrey, right? And I think that also goes into play with us actually teaching people their culture and their history, right? If we're not passing anything down, or we're not having conversations on what we do have and what we do know, then people aren't going to be so prideful, right? Like, for instance, we know, that gay folks have been around since the beginning of time. We know this. And why is it that it's only wrong for us to do it? But when we talk about the Greeks, or we talk about the Romans, that we it's like this beautification of that shit, right? It's like, oh, it's so lovely, like to see two men on a wall, they half naked and they doing whatever they're doing because it's Greek culture. But when it comes to Africa, because again, it's been here for generations, we put it down. But again, it goes into also learning the culture. A lot of people have above us the culture. They know their culture. So for them, they're able to obtain whatever, and they're able to be more laxed. But again, we have to get into us being our own griots again, right? And we have to talk about really like where this came from, what that came from. Because again, being transgender is being two-spirit, right? But again, people want to sit up there and denounce it, right? It's so normal, right? Black women were over tribes and shit back in the day, right? They were the queens and the kings of tribes, right? Men were, doing this and doing that. It's just, again, we have to branch out and we have to show our younger folks, because older folks already know it is what it is. We can't stop you. Maybe you can be, maybe you can be persuaded. But right now, I think it's really important to hit those who are open and who are fresh, to, kind of like teach them that culture and build them up so that we don't have a repeat.
If I may jump in, I joke, I can't remember the movie it comes from, but there's a comedic line that goes, there's principles and principalities to this shit, right? There's principles and principalities to our life and living. And that culture word sort of encompasses that too. We don't have the privilege of knowing, of having in some way, shape, or form through history, codification, lore, story passed down, how things actually work and are passed on, right? I love, first of all, thermodynamics says energy is neither created nor destroyed, but transferred from one form to another. Transference, we call them generational curses. No, the impacts of decisions and choices that people made that had a result, and therefore the impact was transferred down and on. We don't have the privilege of knowing what are these things that we do and have been done to us that keep maintaining this status quo. system. And so we have to, I think, look within ourselves. And I'm big on, reconnecting with spirit, because as I watch my cat, somebody dumped a cat on me years ago. Wasn't a cat person, never came back and got it. I didn't know what I needed to do to take care of a cat. Well, thank God a cat didn't need nobody to tell him nothing. Everything the cat needed was in it. The cat found the litter box, found the food, everything. Well, the same is within us if we will allow ourselves to go to that place and connect with each other collectively, as a community again.
I love that allegory, and that leads me to my response. Wow, that was powerful. Allison, we need to connect like Corey and Jeffrey doing, because they synergy. And I'll leave off where Jeffrey left off. The biggest question is what's needing the Black people to wake up and educate themselves. And again, these are my I statements. I'm Black. I'm very proud of that. I can't speak for the whole community, but what I noticed in my profession by being part of this Black community is one is what Jeffrey said, it's already in us. We have that level of privilege, and we should start allowing that privilege to come out of us and not substitute it with trying to keep up with the Joneses. You understand what I'm saying? If you can't buy Kraft mac and cheese, you may have to get generic and add some seasoning to it to make it taste good, but your belly will be full. I think it's important for me to point out a couple things is that in order for us to be educated as a Black community, we have to understand a couple of things, because this ties into HIV dollars. It ties in where the dollars are being advocated, such as like the census that most of us never complete. Okay, I'm just, I'm in a spirit of call out. I don't know what it is. I hear you, Lord. As I will say in my pulpit, I hear you, Lord. That's the first thing. The other thing is, do you know where your taxes are going? Do you know that a portion of your taxes is going to federal funding, and you have a choice to know where that money is being allocated? And so if you're not seeing that money or resources, then the next piece is that you have to understand policy and how to drive policy and how to show up and not just vote for a candidate because we got tired of Trump, but vote for a candidate because they're speaking on behalf of your Black community. That's the next one. The other outside of policy is that we have to break, and this is going to sound contradicting since, I am clergy, but we got to break that religion mentality that we are the pew members, and whatever that presby or that pastor or that preacher say is golden. You got to open up the book for yourself and start talking back. It's not all about an amen. It's not all about paying your 10%. It's about you showing up, finding out what is the disparity. Pastor, why are you not preaching about HIV? We are dying in this community because we are responsible for advocating and challenging our leaders to do what we want them to do. I'll end with this, two things. Be okay showing up to be an interrupter. When you walk in the room, you probably don't have to say it. First, we ain't much of us that are Black, we ain't got to say nothing because the light is on. We walk in, they think the light done dim. No, that's because we are interrupters. We got so much culture of hurt and so much culture of empowerment that we need to use that to our advantage and start being an interrupter. And then finally, be okay to use your voice. Ask those questions. There is no dumb question. Ask where money is going. If you got an ASO like a church on every corner, walk up in there and say, I'm not a client, but how do you get your funding? And how do you allocate your funding? Go to their website. Get involved with city council meetings. Get involved with the school board meetings who are teaching our babies that sex education is not important to them to help reduce HIV in our young babies. It's our responsibility. So waking up is we are accountable to get the education. And if you don't know, somebody knows. That means we need to start talking and coming together.
Yeah. And if I may, stop waiting on somebody else. To who else is going? Who else is going down to the council hearing? Who else is going to the community meeting? Who else is logging on? Oftentimes we know in our spirit, we know something don't be right. We have a set of knowledge and experiences that something connects and we can share it. We can log on to that city council meeting, that community meeting, that organization meeting and share something, but we don't because we feel, oh, I can't do that. Oh, I need to know other folks are going. Well, are you going? Are you going? Are you going to speak out? No, you speak out. You have the recognition. It's been brought up in your awareness and your spirit and your consciousness and through your lived experience for a reason for you to share it and to bring it out, to others. So we have to also stop that, that reluctance because I don't know what other people are doing. Right? Trust yourself and trust the lived experiences within you. And that inspiration is calling you out to actually activate that activism that's naturally within you.
Oof. All right. Y'all, I told y'all we about to get deep here. All right. So I something that really resonated with me when we talk about the disparities. Black women. The CDC reports that Black women are hit the hardest by HIV, as the rate of diagnosis is 15 times higher than white women. And before there was a time we wouldn't even think that Black women would even be affected by HIV. That was, it was always the gay men or MSM. So now we're seeing Black women are now number one. What are we gonna do about it? So I'm gonna leave that to of course, like Allison. I can put you on spot on that one.
Oh Lord, I knew that was coming. I was like, me and Carmen, I was like, sister, I was like, hopefully, sister, she just did her preach and she needs a minute. So when I think about, when it goes back, when we talk about the disparities with the Black women, everyone wants to bring up education. How do we educate? But with those numbers that you see, Black women are amongst the most educated population in the United States. We're not dumb. We're very smart. And what it comes down to is access. It comes down to people telling us, where can we get this medication? Our doctors telling us, you might want to go on this medication. I think it goes back to being free, sexually free, to be able to live the life that you want to live. I feel like we're told that, we're portrayed as being these hypersexual people. Then we're told, no, you have to keep this this really, church lady, good girl attitude. And then, you don't have the authenticity to really be yourself. You want to be this woman, I want to go out and date, find out who's the one. And sometimes when I'm dating, that things might pop off. When are we having these conversations about how to protect ourselves? Our doctors are not bringing it up. I mean, they can make sure that we get our breast screening every year. We get our diabetes screening every year, our heart disease screening every year. They just need to integrate that in the conversation and just say, hey, look, I got your boobs are good, your blood is good. And let's make sure that when you out here having some good old times and, you're getting your thing in, that you have PrEP and you're taking care of yourself. It needs to fall in line with, are you using condoms? Do you need birth control? Do you want to be on PrEP? I don't think it's a difficult thing to do. I think it's a conditioning, a socialization type thing with doctors. It's like you ask about everything else that's going on. You ask me if something's aching, itching, burning, all that stuff, but you can't ask me if I probably need to be on PrEP. I don't think it's definitely not an education problem. It's an access problem. Is making sure people have access to these items and making sure that they know that they can get them. And doctors saying, hey, you know what? You might want to be on PrEP. Just like they asked me if I want to be on Lipitor. Ask the questions. Give them the access.
So I guess I'll take the point of privilege and try to chime in. And I'll say this very respectfully and whatnot. I own my privilege, which means that I own that I know I get lumped in with data. I get lumped in with my presence being part of this conversation. And I think that most women of trans experience, we need to start owning our privilege because what our sisterhood of the cisgender go through, we go through it as well. We just see it differently. And that brings me to my point. First of all, we don't have data. That's the biggest thing. So we're talking about access. We don't have data as it relates to Black cisgender women. We barely have data on women of trans experience. So that's one, is the data. The second is that if we think about how women are not respected in their privileged role, that they are a disservice only to have children only to do the, homemaking, inside the house. They are real. In our culture, we preach that a woman should know her place. The man is powerful. We have all that embedded in us, even from a religion standpoint, is that you're good to make babies. The Bible hardly ever talks about enjoying sex with a woman unless you were a concubine, unless you was that side piece. And to us, that was considered New Testament. Side pieces was sin. So we have weakened the definition of what a woman, knowing that a Black woman is the strongest out of our entire race. Not only because she can carry kids, a cisgender woman can carry kids, but can you think of the mental aspect of keeping the family together? I say all that is that if we have been taught that women, cis women, and I will even use the privilege of trans women because we see it, I cannot believe, I got 24 years living out my truth and my purpose that God gave me. But the first thing I heard is that you're going to lose your privilege if you become a woman. And I dare them. That's why I fight so hard to be a leader in my community that also supports cis-identified women, because we got it wrong. We got the definition wrong. And because of that, we don't see them being marketed in research studies. We don't see them being marketed in HIV prevention campaign plans. We don't see them because why? We don't even see them in tier leadership. Let me start there for agencies that are on here. We don't even see them in tier leadership in order to pay them what they're worth. And you want them to go out and mimic them and bring them into you. You want them to be your tokenized example. With all of that saying is, we are in a time where, because of no data, because of no representation, because how we prioritize privilege versus non-privilege, access versus non-access, now what we saw in the women of trans experience community is now being transferred to our cisgender women community. Now, let me be an advocate and let's bring us together as a call to action. This is why we as women of trans experience and those that are cisgender women, we must come together and have these conversations. Sometimes they're courageous. Sometimes I was probably sleeping with your husband. Just truth be told, don't get jealous or whatnot. Let's ask for forgiveness because I didn't know he was your man. Okay? He saw beauty in me, but you're beautiful. We got to learn how to come together. Have this conversation. When we say woman, there should be a distinction. We all are subject for the funding that is coming from the federal government because a woman is a woman. I choose to tell you how to define me. The final piece that I'll say from a reproductive justice lens is that find a way to inclusively and equitably add our masculine trans men. I say that respectfully because the womb of that is still important for those that represent trans masculine. And if we don't also target them in not the cis women or trans women conversation, but from a reproductive justice conversation, then it will then fall on them like it is. They're ignored in a reproductive lens. If you think about policy abortion, everybody got their stance on abortion. But no one ever considered the person who has to go through that decision, their body. It's the same situation. Hire cis women, hire trans women, increase your employment for trans identified masculine people, and let us show you, let us be the lived experience at your agency, and let us be the gatekeeper that brings others in. Otherwise, if we lose our cisgender women, we're going to lose the future of Black people. Who going to birth us? Who going to nurture us? We adopt that when we are exiled out of our community. We need the original womb, no disrespect when I say that, in order to live so we can continue to live as a culture and Black people so we can thrive. And HIV is killing that process. And we cannot allow that to happen.
And man, all of that. Because I've been itching just to say that, no, it's not that, Black women are not as knowledgeable and aware. And yes, we know about the access issue, but systemically that exists, right? ultimately Black women and women, period, have been let down. Let down. Somebody said in the chat, you hold the whole world on your shoulders. But yeah, when you literally hold the whole world in your hands, everything that rains down on the world settles onto you. And that is the lived experience of Black women, women of color, and women, period. And so from my perspective, you know, as a gay identified Black male, we have to step up and step out, and I think play our part in leading and having these conversations, having the privilege of being in a place in life where I've created where I can have conversations about sex and sexuality and sexual behavior in a way that many in my family and community cannot. And since I can, then it's on me to create that space so that we can have these conversations, because ultimately at the end of the day, we find ourselves in this situation because nobody is actually talking about the nuts and the bolts of sex and sexuality and sexual behavior. We're caught up in the culture conversation and the religious demonization, and we use the word again, stigma. But all that is noise. It's just noise. It's just noise for maintaining a disease culture. And so we got to get to the place, you're doing it, you're actively engaged in it daily and day in and day out, where we can actually talk about our behaviors and actually own them so that we can actually change the climate and atmosphere. We can't get to a space where you can walk in a doctor's office or a clinic and get that kind of treatment and service you need if we can't even have the conversation about, you know, how sex and who's having sex and type of sex, all that kind of thing. And so I think those of us, particularly men, who've created the space where you're out here and having these conversations, have to own that space and really step up and be those advocates in creating that space on behalf of our women.
Whew. Thank you. Oh man, y'all said a mouthful. I definitely want to respect everyone's time and whatnot, but is this conversation, as you can see, this should have been a little longer because it's getting good, it's getting heated. But there's, Allison, you touched on something when you said is that Black women are one of the most educated, you know, before it comes to education. We are definitely educated. Black folks, period, are educated. So when it comes down to PrEP and PEP, why is it that when we bring it up, oftentimes we're the ones that don't know? Or, you know, the question is, how do we advocate for ourselves? Because if we, you know, the ones that do have access, or maybe, you know, the ones that could ask that question, how can they advocate for themselves? And how can we make PrEP and PEP more aware in our community so we understand? Because, you know, again, we have our own language. We talk to each other. We're all not monolithic. So how do you call that conversation?
I think I saw a comment pop up about calling the vagina the pocketbook. We need to stop with stuff like that. We need to stop with this little, you know, poo-poo foo-foo language around penises and vaginas and what's going on with them and how we use them and how we like them touched and how we like them to feel. We need to stop that. We need to stop that. This conversation needs to get a lot more real around that, so that we can say, you know what? I do like having sex with people on the first time when I meet them. And if I like them and, you know, we kissing and hugging and things are going down, sorry. I mean, I consider myself a good Christian woman, but sometimes I've been in situations where it's going to happen. And I know a lot of other women are in that same situation. My experience, I've never been asked about being on PrEP. I would have loved for a doctor to say that, so that when I go into that situation, I'm not saying, you know, do I have condoms? Do I have this? You know, okay, is everything good in the line? You know, let me make sure I'm good, so that I don't have to go back later and say, you know what, give me that HIV test and make sure that I'm good. I can know beforehand that, oh, I'm good. I'm on PrEP and I'm good. We just need to stop those little poo-poo foo-foo conversations and get a little more real. I may not have addressed your question properly, but, you know, I just think like the conversation needs to get a little more real. And I'm sick of hearing about the pocketbook and, you know, oh, you know, when a man and a woman lay together, or when they, you know, when you get together with somebody and, you know, when you consummate, it's like, when y'all getting down and, you know what I mean? Like, let's talk about it. And I know everybody is not in that same space where they don't want to say, you know, getting down and popping. I understand that and I respect that, but we also have to get a little more real about, you know, what those situations are. And a lot of people are just out here living really good lives, but they're ashamed to tell people that they're living that. And that's you know, stigmatizing. You know, so yeah, we need
right back at it.
Right, I'm like, y'all know, I'm not a linguist. I don't have the good verbiage, but I'm gonna stop so y'all can get the rest of everybody up in here.
Living. And if I can add in, right, I think that also there's a lot to unpack with this, right? Like as a man, I can't even get prepped like that. They asked me how many people I was screwing. They didn't even know my deal. You know what I mean? I had to lie and say I was screwing 20 people. They was coming to my ear, all this crazy shit in order for me to get one pill. You know, and if that didn't happen, I had to buy it from somebody. So it's real, right? And so when we talk about women, or we talk about female-bodied individuals, or people who were female-bodied, the situation at hand is that there's a sense of misogyny and misandry, right? That goes with everything, and that's just what it is, you know. Whereas yes, Black women or Black female-bodied people specifically are the first ones to go to the doctor and get checked out or do whatever they need to do, but they're not being offered that because we have old school ass doctors who are fucking 72 years old that still think that, again, it's 1916 and that people are in these like one-sided monogamous relationships and women don't have sex and it is what it is, right? These are old school values that are being passed down and passed down and passed down. I think my last doctor, they were born in like 1932, got their degree in like 1952 and didn't know what the hell a trans person was. And I was pissed because I'm like, you know what? I should be getting your check because I'm teaching you how to take care of me, or I'm teaching you how to take care of the next person, and you're still not retaining it. It was dead ass, whereas I was like, okay, baby, you got to write this prescription. You got to do this. You got to do that. Go on WebMD, check this and check that. We shouldn't have to do that, right? And that also goes into context of us having younger doctors, us having Black doctors, us having people who we identify with. And don't be afraid to fire your doctor. Fire their ass. If they are not doing what you ask them to do, I don't care if it's the dumbest question in the world. If you're not answering the way I want you to answer, I'm going to fire your ass. I love Kaiser because you just go online and be like, you know what? Fire. And I'm going to get a new doctor. And I'm going to do it over and over and over again until I get that doctor. We also have to normalize conversations around labels and what that looks like. Labeling has hurt us as a people, as a whole. In reality, who's to say what straight is? Who's to say what gay is? Who's to say what bi is? And who's to say people just don't identify with that shit? You know, we are a people specific, we're a person specific people. I'm very straight, but let me tell you something. Look, if a hole is a hole, and if I want to feel good, I'm gonna feel good. It doesn't matter. Now, I'm emotionally attracted to women, but that has nothing to do with my sexual behaviors, right? They put a prostate in the ass for a reason. I'm just saying, right? Or they put a clitoris somewhere for a reason, right? And in reality, it's not up to anybody else to determine what the fuck I'm supposed to be doing to feel good, right? And we have to talk about that as a whole. We can't judge each other based on what makes us feel good. Because in the end, we're never going to have these conversations, and we're never going to be truthful with ourselves or have honesty within that office. How can I be honest with somebody white when I can't be honest with somebody I look like and somebody I vibe with, right? It's one of those things, right? And the last thing I want to say is that, yes, you know, when we talk about just stigma in general and what that looks like, I hate the word stigma, and I hate also the policing of language. Stop policing these people's language. I agree with Allison. Look, I say pussy and dick all the time, excuse my language, right? For those who don't agree with it. But the situation at hand is that's me unapologetically owning what I believe and saying what I believe, right? Because again, if we police other people's language, we make them feel as if they're less than, and we make them feel like they're inferior. And in most cases, they're not open enough to share things with you because you're judging them low key, right? And the situation at hand is that comes from white supremacy. We're talking about decolonizing our language and decolonizing sex and being able to be free Black people, because we always talk about free. We should be free. I want to be free. I want to be a free Black person. I'm going to raise a free Black child. If you are judging every single Black person you meet based on somebody white who has no culture, then what the hell are we doing? We'll never be free, because you're still living in that context of somebody else's thought process for who you are. So I just want to leave that at that. You know, when we talk about down low culture and shit, there's no fucking such thing as down low culture. He just getting a nut off, and you should too, because in reality, sex should make you feel happy. If you're not happy in having sex, you should just call that whole thing off. Tell that person to put their clothes back on, get the fuck out your house, because sex should be enjoyable. and it doesn't matter with who you have sex with.
Thank you.
So
Thank you.
That makes me go back to like early child, rules. It was sort of automatic when I was a kid. Your parent would tell you, if you found yourself doing anything or you did something, then somebody came and told you couldn't tell nobody about it, and you had to keep it as a secret, then that was bad, right? You shouldn't be doing that, right? Well, here the thing here is we gotta shift that when it comes to sex and sexuality. We keep this sort of stigma around sex and sexuality in the box, either procreation or misconduct. And the reality is, sex is a divinely created experience that is natural to our life and living, for procreation and for connectedness. And so it's sort of, a lot of this is getting out of the man-made religious frame about sex and getting exactly as you all just said, having these, real conversations. I start earlier in my career, I did sex ed with kids in schools. And it's like, if you could start there just with the simple basic, get all the mess out, right? Just real clear conversation about what's what, then imagine the new landscape and paradigm, you would set up for the future. And we keep sort of that, and particularly as Black folks, sex, we still in that, thing. But at the same time, we all know what we doing, when we with our person or whomever. And so we got to lay down all that mess, all the hypocrisy, the stuff that we know is not true to our real identity when we get in family, when we get behind the closed door that we have maintained in public, polite, white society for so long. It is time to let the mess go.
Gotcha.
So I guess I'm next. Let me see how I can follow this. Let me put my capacity building hat on real quick to answer this question. How can we expand awareness and access to PrEP and PEP in Black communities? First of all, people understanding what PrEP and PEP is, pre-exposure prophylaxis and post-exposure prophylaxis, which means that for those that are looking to secure their bodies from contracting HIV, you have a PrEP pill that you can take to assist you with that with condom use. And as well, for those who feel that they were exposed within a 72-hour time frame, I like to say 48, take yourself to the emergency room, to urgent care, and let them know and request that you want PEP. I said to say all that is that expanding awareness and access. First of all, the original when PrEP came out, the toolkit did not make it to us in the Black community. That's the first thing, okay? The pill was designed for gay white men, and it stayed in their community until we lucked up on it and start making a fuss. Why is this not in other communities? And then when we got it into our community, we don't know how to educate our people by it because there's so much mistrust on what the pill actually does. If you go to the top 3, I'm not gonna call them out, the top 3 national HIV public health prevention website, type in PrEP in their search, you will get 3 different definitions of what PrEP is. I'm gonna let that resonate. And for those that are administering PrEP in the Black community, that is what we hear. We don't have consistent messaging when it comes to PrEP. We don't have consistent messaging as it comes to PrEP and culture. We don't have a consistent message as it comes to PrEP and religion and faith. We don't have PrEP and religion when it comes to grease and butter at the same time. I'm gonna call it out. We don't have a consistent message. So what do you think that, how do you think rather that PrEP gets into our Black community if we don't know how to join the message? That leads me to another call to action. For my Black people, my Black friends, my family, if you are on PrEP, I need you to become an advocate in your environment to teach others about PrEP. You become the gatekeeper so they can see someone who trusts the science, the evidence-based science of the medication that will secure us as a Black people in our environment, in our atmospheres. Need more people to show up. That is what we're lacking. Shame on pharmaceutical companies I get a check from them. This is not a call out, but we got to do better that PrEP is for everyone and find that evidence base from research. Call the people together, get the research, get the placebos, do what you got to do, and make PrEP available educational wise. And then we do our part for funding to make sure that it's getting to hard to reach places. We ain't even talked about Black people in rural areas who ain't got crap. That's another thing. So what can we do? We can educate ourselves. ASOs and CBOs and those clinics who are administering PrEP can do better in outreach. We need to remove the stigma that this is this is a pill mixed in. As soon as they hear HIV, it's like, oh hell, I don't want that, because there's too much stigma around HIV. How come we just can't say it's a body vitamin that's going to prevent you from a sexual transmitted infection as HIV? You take your one vitamin a day and let that marinate, and you be responsible in assisting your vitamin by putting a piece of plastic on. And if you got to put, and we don't even talk about, I'm sorry, I'm getting beside myself, but we didn't even talk about lubrication. We don't ever practice how lubrication is another prevention tool to secure the lining of whatever hole of the wall that you're sticking in. We can mix all that together and let it be a wraparound service.
Wetter
So
is
for
better.
my Black people, we got to get educated. We got to get educated, and we got to challenge those who are administering PrEP to our community to make sure that they're reaching out to us. It's a sad thing that before I left public health to work for HRC, I had to tell a 77-year-old woman that she was positive for HIV. I had to tell a 66 man that he was positive for HIV because we forgot to share with them that PrEP was available for our elderly community. We don't think about that. It's sad when you have to give a diagnosis to someone who is young, under the age of 21. These are Black folks. So we need to show up. If I can get all my Black folks, I don't care what your orientation is. I don't care who's thinking who, what pelvis is smacked. I don't care about all that. I need you to show up, embed your testimony into our culture. Let it be a message so others people can say, I know you and I trust you. Where can I go? And we will see an uptake in PrEP, and we will see funding more available to us, because I don't care what nobody say. PrEP is free. Know how to work the system and
Sure
get
is.
your one pill a day, because it's free. These agencies are getting the dollars, the 340B, and I dare them use it for money to buy computers and increase salaries when it's meant for us to have PrEP so we can thrive. We shall not die, Black people, because of HIV. This in the HIV epidemic plan, I rebuke it. I feel like I'm in church now because it has us written in that. But did they come to you and ask you about your narrative? They did not. So let's write our own plan through action and gather your constituents, and let's be on the front line, do some call outs, some accountability, get that coin, and make sure that we live as a healthy race, which is Black people.
Ashe. Woo!
You're gonna drop the mic on that one, Miss Anderson Harvey. You're gonna drop the mic on that. I don't even know if I can even follow up with what piece that I have after that. Just
that upload your testimony into the culture, download your testimony. What you say? That was fire. Because we need to upload our testimonies, because each and every person on this call is a living testimony. The fact that you right here, right now, telling your story into our culture as a collective, because it has been missing. I love that, sister. Woo!
True indeed. So, oh man, I wish we can go longer. As y'all can see, this was a great conversation. But before I turn it over to my co-host so we can do the Q&A, I do want to respect everyone's time. We have Miss Allison, Mr. Jeffrey, Miss Carmarian, Mr. Corey. These are our panelists. These are some of your gatekeepers. These are some of your resources. If you all need help, if you don't know where to go to, these are people that you can trust in the community. So I would like the panelists, if y'all could plug your information in the chat, the chat box. People can have your information if you don't mind. And we're gonna do the question and answer. I'm gonna turn over to my co-host. Again, we're ending the epidemic in the Black community. We are not playing no games. We are going to end the epidemic. We are not going to die. It was a call to action. We're gonna live by it. We're gonna go for it. Let's all do it. Trey.
Thank you for that, Ty. And I also want to thank the panelists. Like, oh my gosh, you guys we had a great discussion today. I learned a lot myself. Like I told you guys before we even began, I'm very, very new in the work that I do now, and this is provide a great foundation, just for someone that's coming on new on the board, trying to be that advocate, trying to be that leader amongst the community. And I think conversations like this that we should need to consistently have on. Just to bring, just to define no more things for people. So, because like I said, it's all about education, as Kamarian said, just educate. Ask the question, no dumb question is the wrong question. Ain't no question is a dumb question to ask. So I really appreciate all the wisdom that all the panelists was able to give. I very, very much appreciate you. But I do want to open it up to our guests. Do you have any questions for our panelists? Do you have anything that you need help with, like any resources you need to be linked to? We have our panelists here. We have, like I said, we got someone that's all the way in California, Mr. Corey. Like they're here to help. So if you have any questions, just refer them to the chat box. I'll communicate that to the panelists, and then we can get the answers now.
Trey, while we are waiting for people to upload their questions, I want to take the opportunity to thank our panelists on behalf of Damien Ministries. My name is Gail Oliver. I'm the executive director. This has been fire. That's all I can say. You all have certainly done my heart well. And in my past lectures, I have spoke of this year, we always get the broken crayons. We get the broken crayons, but what we have to start telling each other, they're broken, but they still will make the color come out on the paper. So we have to learn how to just look at it as we have two crayons instead of one broken crayon, because we have to get the message across to our people. Damien Ministries is on a hardcore course and a movement. All of you represent the movement that we are trying to make sure that people see, hear, and know. We are here to stay. And we have to stop thinking that we are empowering our community by giving them a certificate and a slice of pizza. Not my style. We have to stay with them until they are on their own. We have to be made fishers of fishermen, teach one to fish so that they can continue and teach the next person to fish as well. So when you get into the scripture, people keep talking about the sky's the limit. No, God's the limit. And all we have to do is pay attention and don't be afraid of the broken crayons. Again, thank you all. Enjoy your Valentine's Day. And this has been one of the most amazing conversations that I have sat in a very long time. Ladies, commend yourself because you all blew it out the box. Thank you so much. Trey, wonderful job. Ty, wonderful job. And I defer so that you all be able to answer questions from the chat box. Take care.
Trey, you on mute. Just so y'all know, we're not gonna keep y'all up long. We probably got hold on no more about 5 more minutes because I know y'all. It's Friday. I know y'all got scheduled. So if y'all gotta hop off, we understand. I'm gonna ask the questions real quick. We can't get all the questions answered. We will email y'all with the responses. Okay.
So this is just the first question I see. It's from Corey Roroya. It says, "What do you think?" And it's not directed to any of the panelists, so anybody could chime in. The question is, what do you think is the way to bridge the gap between Black, African American, and African? I'm sorry, I don't know what the rest of the acronym is.
It's AFAB.
Yeah. AFAB woman and Black AMET woman in respecting the sexuality is fluid to help their download concept. And let me know if the panelists need me to reread that because that was
And so the people that don't know, AFAB means assigned female at birth, and AMAB is assigned male at birth. So that's what acronym is standing for. Just so those who know.
Thank you for the clarification. Appreciate it.
Does anybody want to answer before I do?
Go ahead.
This is my favorite subject. So there's no such thing as a down low culture. To be honest with you, there's no such thing. What is down low? A lot of people say that down low means that like men are going to trick women and go sleep with men and the whole 9 yards. That's not real. To be honest with you, again, we have to get into the habit of having conversations with our partners and what they like. What that means is, say, for instance, I used to work at a bathhouse, and that bathhouse was Steamworks. Lord have mercy, Steamworks. You know, and to be a trans man in Steamworks, it was really interesting. Just to be male-bodied in Steamworks, it was interesting because everything that I was taught prior to me transitioning went out the window completely. I have seen family members in that place. I have seen friends. I have seen people in the neighborhood I would kick it with. I would smoke it. You name it, I've seen them up in there. And the most important thing to remember is that when I speak to these people or when we have conversations, we have to normalize conversations as Black men around sex and pleasure and what that looks like. And we can't put each other down for it, right? So say, for instance, even when I'm around my wife, because we're very heteronormative, I live with a woman, we go drink tea and coffee and shit, we walk our dogs, you name it. It's very vanilla, it's very, you know, stereotypical. But even when I say something, she tries to get at me and she says some shit like, that's gay. And I have to be like, wait a motherfucking minute, gay? What is gay to you? And why are you telling me that? And I'm woke enough to do that. But again, we have to get into the habit of not putting people down for what they like, how they present. You know what I mean? Because in reality, a lot of people go out and do things. If I can't get head at home, I'm gonna go out and find head somewhere else. No shade, right? And so we have to talk in the beginning or even throughout these relationships about what we like sexually. If I'm not getting it at home, I'm gonna go somewhere and get it at wherever I can get it. If the next homegirl down the street ain't gonna do it for me, I'm gonna go get homeboy down the street because I know he give good brain, right? It's the same thing. And so again, let's just get out of that down low culture thing. We have to have those conversations. We can't put people down. It's the same thing with women, right? We sit up there, I got a homegirl, she loves to have sex. She's all about that life. We talk about it. She'll call me and be like, I just did this and I just did that. We have to be realistic. I'm not gonna put her down and be like, you a whole ass hoe. For what? She's living her best life. And if someone is hating on that, that means that they're incapable of living their best life. You see, people who put people in these boxes are the ones that are afraid to be their true selves. So that's it. That's all I want to say. There's no such thing as down low culture. In reality, we have to have the conversations and we have to be more woke than what the hell we've been.
Thank you.
I think that's great, Corey. Let me offer this real quick. When I interpret this question, I also interpret it as how do we also reduce HIV, the stigma in those who are practicing their sexual intercourse in secret. I'll use that word. And I think it's important for us to understand, we alluded to this earlier about culture. I alluded to that we have to start making shifts happen. In other words, in our culture, we're taught binary. It's either or. We're not taught fluid, okay? But I want to remind you of our religion and faith culture that we teach we must love everyone and that we must love our neighbors as ourselves. There are some things I can do to myself. And if I can do it to myself, I'm gonna do it to the next person who's my neighbor. I'm being human when I say that because I think it comes with how we rear the language in our culture from a beginning. If we start talking about in our conversations, in our social media posts, in our churches, at the barbershop, at the beauty shop, at the grocery store, doing Thanksgiving dinner, doing Christmas dinner, doing Black Eyed Peas, for New Year's, if we start having conversations about how we language things and call out why we feel we don't accept it, and this is not an excuse because the Bible says so, that's not an excuse. Why don't you accept it? Because you can't define something if you don't know how to put a definition to it. And we got to be okay of having these intentional conversations that this is my son and this is their partner, boyfriend, whatever their label is, and be okay and not turn a face. It's our culture that's keeping the word DL. I hear what Corey is saying, but for someone who is a woman of trans experience, we still label them as DL because they tokenize us because they come to us before, along with, the MSM, but they come to us to get what they need. And then they go back home. And what happened is there's a transmitting. Now we're talking about HIV. So how do we have these cultures? And so my next call to action for those that want to be validated but you want to be validated and seen, don't accept people like this. Accept their truth and help them live their truth. That is what's going to help us not getting contracted with HIV and other STIs. That's going to help us so we won't have to stay in the closet. That's going to help us to say when there's no one around, I can look in the mirror and affirm myself, because sex don't have to do it from someone who can't even live out their own truth. Don't put yourself in that risk, baby, because when you do, then the next moment is we're coming up to Damien Ministries. Can I get tested? Now they got to put me in medical care. And had I knew that I didn't have to accept non-truth, I always accept the truth, because the truth of a person to come and say, I want to lie with you, but I'm also HIV positive. Well, let's have a conversation. You still don't get this. You're going to have to put a condom on. I yield my time.
Oh, man. Oh, man. And with that being said, like I said, we don't want to hold up anyone else's time. I want to thank everyone for coming out. Again, my name is Ty Williams. We got Trayvon, Damien Ministries. We got a fabulous panel. We are ending the epidemic, y'all. This is our community talking to you all. This is our community being represented on a wide spectrum. Okay, we're going to end this epidemic. I won't hold up any more time. Thank you all for coming out. Thank you for being here. Thank you, Miss Allison. Thank you, Jeffrey, Carmarian, Corey. Thank you all so much. Thank y'all, and we are out.
Yes.
Have a great weekend.
Have a great weekend and enjoy the 4 days.
Everyone be safe.
Miss Gail, I'm gonna call you soon.